30 radiation treatments and 2 weeks of 24-hour chemo, all within a 6-week period, was an exhausting whirlwind. It was a full-time job to manage the side effects. During my hardest moments in the radiation suite, I would look at the cherry blossoms on the ceiling and enthusiastically sing to myself. I can see clearly now, the rain is gone. And then I began telling everyone that this was my theme song. It wasn't until my first post-treatment follow-up visit with the radiation oncologist that the receptionist handed me a clipboard and the Putting Patients First questionnaire. While sitting in the waiting room, it was a challenge to quickly rate things like pain, nausea, and anxiety. As I got more familiar with the form over the next months, I began to appreciate how putting things down on paper actually helped me understand the depth of my symptoms. And I saw how my care team had a clearer picture of how I was coping when they reviewed the questionnaire. I noticed how it was easier to discuss more intimate concerns like diarrhea or feeling blue, as a friend of my daughter was sitting in the examination room. I also received referrals to psychosocial nutrition services when I needed it. A year after my diagnosis, I was happy to see a recruitment poster for patient advisors at the Cancer Center. At one of the meetings, it was suggested that all members sign up for MyHealth Records. When I logged in for the first time, I was surprised to see all of my lab results going back to 2018 and my immunization and medication records. And I could print them off if desired. No more waiting for doctors to call me when my blood work was okay, and I could compare my lab results over time. I was excited to learn about something called Connect Care, which was being phased in across the province and would eventually lead to a more comprehensive record of my health experience called MyAHS Connect. Although this new system was not available at the cancer centers, as a participant in the pilot project, I was now able to also look up things like my pathology, CT, MRI, and pulmonary function test results. All this detailed information made it easier for me to understand my health situation at this particular point in time. What I really like is receiving appointment notifications and emails as soon as new information like lab results are posted to MyAHS Connect. As a patient advisor, I look forward to having the same valuable information available for other cancer patients once Connect Care is operational. Having an electronic version of the Putting Patients First form embedded within MyAHS Connect will be a great benefit because patients can complete it before their appointment at a convenient time and place with the assistance of their caregivers if needed. Not only will patients have a clearer picture of how they are feeling, their care team will be more prepared when they walk into the room.